How do you know when something is not right with your cyst? It may look the same on the outside, but subtle changes could mean an infection is brewing. In this video today, I'll walk you through what those early warning signs of cyst infection look like, how to tell when it's time to seek medical attention, and what kind of treatment you may need before things get worse. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. First of all, why does early detection matter? At our skin clinic, I've seen so many cases where a cyst started off looking completely harmless, completely innocent, but turned into this painful abscess because the early signs were missed. And once infection sets in, treatment becomes more complicated, more involved, more painful sometimes. So if you recognize these subtle signs early, it's much easier to manage and often prevent complications altogether. So let's look at the 5 early signs of cyst infection to watch for. Number 1, mild tenderness. So if the area feels sore to touch, even without redness, and I'm going to repeat, even without redness, that's an early sign that something may be going on. And for some people, that may be the first time they actually find out that they have a cyst. Because let's say if a cyst is located on an area that is not easy to reach or you can't see, like the back, for example, it may have been there for a few years, but it was so small and under the skin, so you couldn't see or feel it even in the mirror. So, and then one day it starts becoming sore, so people often say something just popped up, but it doesn't mean it just popped up. It may mean that it's been there for some time, but it's about or it is getting infected. Number 2, firmness or swelling. So the cyst may feel tighter, more swollen, or harder than usual. And this can indicate internal pressure or a fluid buildup. And I do have to say that that's very common. Usually people don't have severe pain or some sharp pain, especially at this stage. Usually what they feel is that sensation of pressure. Along with that, in rare cases, lymph nodes near the special areas where the cyst is, if it happens to be in the neck, groin, or armpit, they may become tender as your body starts to fight off the infection. And that's not very common, thankfully. Number 3, itching or tingling. A low-level itch or strange tingling in the area may be your body's subtle signal of inflammation. And I do have to go on a tangent and talk about itching. Itching is a very important symptom. We do talk about itching, I'm talking about persistent itching in relationship to dermatitis and rashes, where people do often have an itch, but we have to realize that itching happens often when something is growing, because when something is growing, they're becoming inflamed, and itching is a sign of inflammation in many cases. So in a case of a cyst in this situation, it does get bigger, it's becoming inflamed, becoming infected, so we do have itching, but also itching can happen with cancerous lesions. When something was precancerous, now it's growing into a cancer, or it's becoming more distorted, more concerning on a cancer scale, that the cells are growing now in a haphazard mode, so to speak, then you may have itching. That's why itching should not be ignored. It could be a sign of cancerous transformation. Number 4, change in skin color. A slight darkening, pink tinge, or yellowish discoloration can occur even before things look obviously infected. And I do have to say that I love seeing my patients in person, because you can see this so well, that like slight pink tinge in person. In telemedicine, you could see it, but you do have to have a great lighting. So the patient always have to have a great light, so I can actually pick up on that, because it could be very subtle. Number 5, warmth or throbbing. If the area feels warm to the touch, or you sense a slight pulsing sensation, that could mean infection is setting in. And I do have to say that warmth is a very sensitive sign of infection, and not only in relation to the cyst, but in relation to infections in general. So warmth does mean an infection. The question is what to do and when. So if you notice any of these signs, don't wait for the cyst to turn red, to turn very painful, or to turn into a frank abscess. At this stage, you need to seek medical attention when you notice any of these early subtle signs that we discussed. Here's what I usually do. I do prescribe antibiotics, and I know on this channel we talk a lot about the dangers of antibiotics, how they alter our gut flora. They can lead, and they do lead, to leaky gut. However, antibiotics are still great medications when they're used for a reason, when there's an indication for the use of antibiotics. And obviously, having an infection, especially in people who have diabetes, who have other conditions, and they could qualify as immune suppressed, is extremely important. So yes, I do prescribe antibiotics, and it basically stops the infection before it escalates. And usually it's a short course of straightforward antibiotics. However, there are situations that antibiotics don't help. You prescribe it, but cyst continues to escalate. It continues to grow. So what do we do then? Then I proceed to incision and drainage. So if the cyst has developed into an abscess, then this quick but unfortunately painful procedure is indicated, because it basically drains the pus and usually those cottage-like substance of the cyst, which is called sebum. So it does come out, and that relieves pressure, helps clear the infection, and promotes faster healing. I do have to say, as I always say to my patients, that incision and drainage is not a removal, because with incision and drainage, it's a infection control procedure. We're trying to control the infection. It doesn't remove the cyst, because the cyst is so distorted that at this stage you can't really remove it. It's not possible. So after incision and drainage, the cyst will definitely recur. It may recur in months, it may recur in several years, but it will recur. That's why for complete removal, we do recommend elective removal of the cyst when it's not infected. And also another quick reminder is that please don't try to pop or drain those cysts yourself at home. That can worsen the infection, push the bacteria deeper, and actually increase the risk of scarring. In this case, in the case of infected cysts, your body often whispers before it shouts. So it's important to listen. So if your cyst starts to feel different, or if you notice any of these subtle changes, it's better to get it checked early than to wait. If you like skin topics the same as I do, then I do recommend that you check out my book, The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health. And it is about how the foods we eat impact variety of skin conditions like eczema, psoriasis, acne, rashes, hives, and etc. And you can check it out on Amazon or Barnes & Noble. The link is in the description. Thank you so much for watching. I'm looking forward to your comments. Until next time, bye-bye.